Hey, hello. Today too is another wonderful day that God has granted us. And you know, I am always excited anytime together we meet each other on this platform to share very deep knowledge from very learned people. And just like we always do this and every Saturday, WTV Consulting Room comes to you from 4:30 p.m. through to 6 p.m. And then so you sign up, baby. I missed you last week, you know, but thank you so much for all the prayers, praying for me to recover speedily. And Rachel, thank you for sitting in. I really noticed the awesome show that you had with the guest Fred, and today too is going to be another interesting topic that we're going to discuss here. You know, over the period we've had series of topics that had to do with fertility, had to do with whether the male or the female, and there are some unique things that we need to know before we move on to the next level. And then so yesan eshiem wo ha se bio sa WTV Consulting Room wonim say ye de normal papa ne de brew information a efi akokudam a wo ye ejuma wo hospital in ya ye ne omo twetwe enkomo no menele ho wo ba eko he wo be ni echencho ni we would just share with you our guest and the topic for today. Stay glued to your chair. Call a friend to call a friend. That this is WTV, your girl Rose Aduful. I'm right here with you. We're going to give you the opportunity, ask your questions, share contributions, and any way that can help you to improve on our health. That is what we are here for. So thank you. Don't go far. We'll come back right with the guest and the topic for the day. Thank you very much.
Don't call me. Ghana for Methodist Asafoma. WTV Enyamfienu 5 years. Hooray! Na enam emfienu mafidida. WTV ADNT. Or yet don't call me promo. And say, Zawiya Methodist Asafoba. Now our business. And Juma Kubia Opeso Bomu Deura. WTV say, Ye Babika, Juma Kuno, and as we got on Yeno. Ya Bomu Deura na what you 2 weeks at the amount 500 Ghana cedis per. And I'll bet ya. Way a Kwanya WTV Faso at the other was say. What time the chi? I'm my room pempenswa and never dream. Yanuti, Methodist Asafoma, Muaku, Mopesa Mubomu Deuru, Muntutumrika, Namumra, Fred WTV, Nani Penfoning Como, Emfa don't call me promo 0593 110733, and now WhatsApp 0256 253461. WTV, reaching out to the world.
Yeah, so thank you so much for sitting through, and you are welcome once again to WTV Consulting Room. And then so you are and come more fire apomude ho, and then nyame adom debiarada odomiyen with obia owonim dear in their field of practice. Today we're going to have another awesome engagement or segment with one of our very experienced residents in 𝗪𝗪𝗪 Teaching Hospital. Na ene inkomodie no an aspect of ma abrabo that has really been of a great challenge to many of our women out there. Some of the research because se wofa ma be to say edu na oye scan e wo moswa obetumi anya be sensia eko enson a ebia na fibroids ewo owon awodie mu ye be pese ye be dori mu ni ahwese aso eye ohaw aso emrebe na wo se ye hospital ne ade na we ye nua be mabako ha se ya owo emunim die pa na oye resident for reproductive health center and family planning. He is a senior resident at 𝗪𝗪𝗪 Teaching Hospital. Na ni dino esotra why by, so I pray I'll crucify your name today. Okay, and see your Dr. 𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗪𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙𝗙 Right, okay. You know the guys have 𝗟𝗓𝗩𝗑𝗏𝗪, so I'm sure we have gallized his name instead of just calling him by the 𝗟𝗓𝗩𝗪. And so Dr. Labi, you are most welcome to WTV Consulting Room. And because you say emra de mauna emretiawa na se wa jiatum so ne yembetwetwe nkomo no onyankopon ensure na enne ye nkomo twetwe no ne ye hwe trying fibroids. Meaning say over the period, ye nkomo die ni nyina mu no e mani bebre bisa me mani bebre so bisa ho asem senia bia esi awo ho kwan ne ade eno ntina ene ye twetwe sa nkomo enti ye wo questions na ready, wo experiences na ready. Ye be telephone lines now so wait me bisa with ye. He wo nye you are adore Dr. Levy, right? Okay, please, you're welcome.
Midas, thank you very much for having me.
Midas, baby, once again. When you say a mother, you know my door soon. Fitty a my way, say yes, must you menstruation, a hono, a norma, a woman, ninsen, a war, menopause, any cacao. At every point, you were issues, okay? When the academy, Miss Sophie, BC. Obi no preaching and the topic is that women have issues. And see when there's also for now or cancer there no create Emma issues for papa. Also for Abraham onyanko for Asia will be brave. Yes, ain't Dr. 𝗟𝗓𝗩𝗑𝗏𝗪. Say can't you try and fibroid ding a dear.
That's a pa akonya wadi ama me 𝗟𝗓𝗩𝗪𝗑𝗏 say me cancer simi hosem. Thank you very much for the opportunity. Me say our kind issues ne dos we biase. Issues ne dos we biase. Me Rebecca mo yankopon last bonds.
You know that.
Na special attachment kakra ho. And I commend more for always trying to find answers to your issues. And you can say into ya mpempine you feel say man dos. Remember it was encouragement to search about their issues and come some more issues we bring into modern day nyekese sa nyamincha de what we talk about fibroid idea it me bibi mamo. I'm happy to be here. But me can't say in saying that there are a lot we can do for you. It's not a terminal illness. And yare show motiana muyemshishona bibia bastan still sanity cry. Pain ka fibroid na obu say a idea about awudi nim bibia awudi any baby abrofa no da bibia de wo and na modi ye immenses and no na man ba hu som yemba and say problem ba ho na edi esroni hu bebre aba our ladies, and I'm here to tell you that there's a lot we can talk about. Fibroid is supposed to be a growth. You can't say idea in you within him. The uterus no a muscle tissue. A muscle tissue with different layers. Your inner layer, your muscle tissue, nankasana your outer layer, no. And then the fibroid originates from the muscle layer, and the masses that grow within the muscle layer. In pain, you know, canisana, oka growth, oka mass, and not a man for you to show me say, oka cancer, na, a patch of cancer, a car fibroid, a benign growth, a dear about the enco cancer, entre beyond the limits into other parts of the body. It will not move from a wooden to another area. Into all muscle areas of the body can develop into masses. But we normally have fibroid that people refer to the ones that are within the uterus.
Into nature say sometimes if you are senior okay no crese you move your fibroids na especially some can say growth in a womb and I say uterus na aboye ho but many just say enye it doesn't go beyond awudi nimo enunti na enye kukram anase enye cancer no we kwa keke no ema yen areshimu p na enti watre yen say eye we say abnormal growth ewo awudi nimo no aso de pa na deba
because one of the things that are difficult to talk about in terms of fibroid air cause said deng na deba Dr. Fako monim de nso nyama no bi ho aye nyam ti ase ye yen hyeda ho ade protein ade fiber ba ye wom say ye were near friend associations ye ten who more fibroid who and can say no interest say those associations had the causes near him say muscle growth and the him near stimulate some muscle growth no him say one more young warrior obi a on water or that long period no I would the end that ho enye it can grow fibroid him say obi a ye fan say oye yekba race obi oye black compared to Caucasian abrofono fibroids are more common in the blacks compared to abrofono yenim say ye share womo busuano fibroid or ha you know it has a genetic link into say busuano fibroid or ha there's a likelihood say fibroid de beba but ye chinsan ye chika kra okay say beginning no shas no okay say out of 10 people 6 to 8 are fibroid. In this okay say majority of the women are fibroid now so okay say or family nima you haven't really said anything because as obia is liable to get it. It should be something we should be so worried about. You should realize that you are not alone if you have fibroid and it's a common thing. There are things we can do for you. Other things are you who say DDMU diet, no nutrition in your good. We notice some people can have fibroid. When we study people have a good diet, good nutrition based on vegetables, no fruits now, they tend to do better than those who are on high protein meat diet. Yeah, who those ones. And one more sometimes when we prolonged exposure to hormones because they say fibroid no it grows with the hormones into who say obi ho anyin say shas ye hormones ne doswa e fibroid into make kese the same way nyin say no to twitwa no hormones ne conform nyin say na den eba form into those who are exposed to hormones for long also are known to associated with fibroids. So na me kai na nya cause me nka say we are we into na wonya fibroid. Then we share one more wonya fibroid that now if we look at the women who have fibroids, these are the things we tend to see around them.
Oh, okay. Doctor, yet that celebrate say woman sa nimdie titiru ewo eduane ho a enokra to me a contributing factor to it now. But the other one I me say obema ye enchechemu afa ho kakra biom about the we say prolonged exposure to hormones. Na say naturally so mo try and say my hormones we mu. And if as long as me ba say pia meti hormones so me what exactly are you implying say sir hormones no ewo ye mo ache no
nti me fam medical school kakra na
we part of fire we hope say better
exposure to hormones anya ding fane say oba wa share bra ase ne menses or share 16 as opposed to obi ane dey share 12 already no ne share 12 no or 4 years more exposure sin obi share 16 ye ba menopause so obi obetwa menopause at 42 compared to be obetwa they are 48. You they are 48 no, or a slightly longer exposure compared to the betwa 42. In total within that period now, which make us say nipa no nyan menses from 12 years all the way to 48 or slightly longer exposure, single be on they are 16 all the way to 42. And that is just a simple example. That is one of them. Say make my example be on wodano or also higher likelihood say you be 5 that is because there is a kind of like an interruption to the hormone exposure. 9 months period, no nyani na hormone near high or system nim. What you say? It will be about 2, 3, 4 or that interruption from time to time, as opposed to obi awa one and now onward dakra. Until then, when we talk about the prolonged exposure to hormone, anyway, there are some women by virtue of their medical condition and begin to take hormones to treat a problem. Until those high dose hormones, so then they may also have a likelihood to make a prolonged exposure to hormone.
We dear kese pa na wode amaye eneno enti se o start o period and term na we ntwa bra and term you have a high chance with me in your fibroids. And then come away there say afei na wo be kan ye ho a and I see share what uterine fibroids are then the bad ni bitimi aya fa ho enti afei kra na ya shase wonye later me na woke wo nkwe ni bi komani giopo ye form kutukwe me no ni atola uterine fibroids woke Dr. 𝗟𝗓𝗩𝗘 yeah, Kolebu Teaching Hospital, or yeah, senior residents in family planning, ewa Kolebu, or no na ye neno chichi and komo and neno, or dear men worry, question the truck to what it, and check if you telephone lines no, now we be sat with questions so ne adia de, yadomase. Enti, Doctor, me pacho, say, Cecilia, my young risk factors near the yes, he said we don't really have a cost to it. Also, ye will more ahodo. Are there real types of fibroids? Ewo honomo.
Inti question on pain no better say patients about bisa say inti me fibroid ni ewo he me fibroid ni ewo he we basically aka say mass ewo awodi anim. Now me ka say awodi no different layers. We have the outer layer, which is called the serosal layer, your muscle layer, and kasana friend intramural, no, and sana your inner layer of the wood friend of submucosal lining, no. Into fibroid no be a bang no, and a man ding per se. Into say what intramural, I call them intramural fibroids. A bang outer lining of the wood near friend no subserosal layer, a bang inner lining of the wood friend submucosal layer, submucosal fibroid. Into to say that types need there, it's about the size and location within our DNA and the amount of types. Other than that, we don't really have different types of fibroids.
Oh, okay. Into say baby a wall location any
the size,
the size
describe it
and more
describe a fibroid.
Oh, okay. Yes. Oh, into obi to me enya obi nti ye share yeah doctor ye to me I should be TV
no so who say description I made mine who say over out of the screen towards the outer side now down on your left you have a pedunculated subserosal fibroid the profile ni say awodin outer side no yat ni hwefi awodin into anka here because say enka awodin mpo nti no friend pedunculated no oko inside the womb so another one be with the same type as in ade so and also the pedunculated submucosal and that's why I say no shadan ka awodin no say move to say grapes be those two and extreme inner extreme outer. Other than that we have different layers but we submucosal and the right side of the image, you know, which moves subserosal and also at the same area, and some pure intramural. It's just about the location in the layer of the awodian and the different types, no, and then we also look at the sizes of each of them, and so can they describe it fibroids, no.
Oh, where they're very deep and yet, you know, it is a share to send your screen, you see, yeah. Ubeside who say odi no ebiana abonten a hange ho anase bia odi no ewo mu pa anase ewo honam ni mu mpese ye hwete se ne kano other signs other symptoms ubeside who
inti majority of the time fibroids are not mal signs mal symptoms. Obi wa ha hospital bi before them call investigation no my friend scan yes or fibroid obi wa the symptom be nearby hospital ko your scan we say about 3 out of 10 30% will not show any signs one call investigation bi anka umpo nim say them but some will have symptom majority of the time no it may cause why I say low abdominal pain. Sometimes it causes some bleeding irregularity, and then obi also say bibi kese on lower abdomen. So those are the 3 common things a man for be who are be push on by said omumbra sabia near what is going on. Into your bad though may come complain of one of these 3 as the commonest one, either say or bleeding abnormality, and nurse of taste and ayasi and ya nurse who say bibi who na ayasi, then that is the commonest one. Obins or investigation for topic of today infertility or nintia I want to end the ember and part of the investigation no who say maybe or fibroid. Se oba ayisa na se doctor no hwe examination ma examination of abdomen na we may feel the mass but and what type of fibroid you have based on location amaka ho it will tell us you have fibroid. Technically the type no becomes important when we are trying to solve a particular problem. In Tioba Hospital, that is not our primary aim. The primary aim is or fibroid and that's only fibroid. And I be before and the mouse symptom or them with the aba. until we would look at it, examine we are knowing some of the complications and the associations of fibroid one. We also look at those ones before we send you for investigation. The person who's a fibroid, the commonest one we like to do is a scan, and the scan now. Which means it will show us signs on the ultrasound that tells us that okay, what fibroid. That's the first one. When we are not sure, there are other things we can do. We can do higher imaging like MRI, a bit natural fibroid, and to tell us the sizes, the numbers, the location, and tell us what to do about it. Based on a particular type of fibroid, then we may do other detailed examination like hysteroscopy, and the 𝗪𝗪𝗪𝗪, but the camera near the share, I would inside and I say abdomen inside to look at it and then decide what we do for you. Until there are ways we can find out if you have fibroid and what fibroid you have. And then based on what we want to do for you, then we add up.
The ways that doctor says they could find out so fibroids any beer they wahin wanna say a necessary say or say uma wakuma etua. Doctor all can be about abnormal bleeding. And I say exactly irregularities. Patobit me a church mokakra and no air patressing.
Brofuna dear banana friend abnormal uterine bleeding.
Okay.
And it say moja ne bano enye menses are expected enye normal characteristics of menses. Inti say oba sa unya bleeding enye nia ubu unsa. Then we worry say something could be going on and you may come in. Inti abnormal bleeding is any bleeding that is not your expected menses. In terms of characteristics, menses, no, in terms of the number of days, how bleeding and as the flow, unya and I pain neck, all those abnormal bleeding. If it's coming before your menses, if it's coming in between your menses, and my menses near too much in terms of the amount of blood you are getting, and my menses near 10 in terms of the number of days you are bleeding, those will tell us that you have some abnormality with your bleeding. Tell your friend abnormal uterine bleeding, maybe friend irregular bleeding. Any bleeding be any suspect any regular maybe friend irregular bleeding. To irregular bleeding be won't tiasia. What you mean by say what is causing this irregular bleeding? Say a fibroid, not say a fibroid any problem baby be a catch.
When you irregular bleeding be any period ubetumi ede akọ na yetumi ashow na ahwe say a fibroids and na say a DA na edeba. Na doctor mesade wo akọ etribute earlier on I will can about not the characteristics but and ma will can about senior contributory factors no who can about age. Say a beer, even the prolonged exposure. Ube to me is subium like yeta who fibroids no which category of MMO?
Thank you. Indeed, because of hormone exposure, you notice that fibroids will occur women of reproductive age. Into obia washe brase till say obe cabra that age group and fibroid because of the hormone association. Say fibroid no depends on regular hormones and our kind to be able to either grow on into that period. It is very rare in obia undo puberty and also rare in one wake up menopause. Within the reproductive age, anywhere from 15 all the way to 50 any time fibroid. And it needs hormonal exposure. The longer you are exposed to the hormone, the probability of seeing the fibroid into 35, 40, 45 and fibroid within that population. Okay. And yes, I member before and I member after, but it takes time to grow. Into woman on hormone every day as a woman. Then obviously by the time we do 30, 40, 50 woman enough hormones, say benya to what you say.
Yeah.
Okay.
Great. And so me back to hormones no in another direction. No. Me person maybe say ebano about fibroids now can say obi ehu abnormal irregular bleedings na yembra na hospital na yahwe amaye na me person maybe say irregular bleeding ya ade eya ye ba more intervention say bibi wo hwa mbetumi aye because sometimes especially ya tafa church ne ade no e be catch us and say TV so kwa na say we take adverts bebre say be ma o hemba preparations e be ma o bibi na anani fibroids no ne ade hospital no most mutumi na fibroids no and I say mo bibi wo hwa mo ye de boy.
Okay, until before I go into treatment for fibroid no share symptoms na me kind irregular bleeding me can about who feels we I say who feels say pain sometimes a pressure blood and into my Johnson 10 into sometimes we want to find out say problem now complain no is it fibroid or is it something else because your fibroid in kwan and those symptoms but there are a lot of things we will investigate for saying we will send you to the lab to do certain investigations. One of them apart from examination and kind they say say this speculum beshe nyahwa wodi na no nyahwa wodi na kasa say bleeding no if you wodi any inside and as if somewhere else so into one thing I was saying is say man some hospital na mo doctor for no some person mo examine more we should allow because when we see the source of the bleeding then we can be sure that the bleeding is coming from wayase anasa wodi nim and we now know what to do in the first one no in infection in any other cause a fibroid then we now take the necessary step yes scan you say a fibroid I confirm it's a fibroid then we ask ourselves fibroid that you either you came with a complaint and now say you scan for something else do we have to treat it until we come from management so you share 3 arms say 1 the best yes abeka and I find sanka 2 you man draw and resolve problems that would that may affect the fibroid and I said 3 you may deal with the fibroid itself until that 3 arm no.
Okay.
Don't forget Semeka say there are some people obeba ayarisa for other things
exactly.
And we notice fibroid obi oha simple checkup or doctor me check him up home say bibia and doctor ye bibia ma me say me say me fine doctor say okay and the scanner say bibia fine doctor ko twa scanner fibroid she ho uti we fibroid in how that a man problem bia or women say regular regular bleeding or I say no ya oba checkup internal we have found information we are not going to do a lot about it if the fibroid is not disturbing you in terms of knee size in terms of knee location in terms of fertility in terms of bleeding it's not giving you any problem we may not touch it because it's something we have observed for example obaba that's also Dr. Monofua main kwakase me if you ho what I say it is a part of you it is not disturbing you until we observe it amount review with time they are steady I say ekohi sana me kan ye ebia na problem however say amount problem symptom to say na can bleed in there then you bet mama withdraw am a symptom na better in terms of bleeding no you bet mama withdraw am bleeding na better you bet mama withdraw am pain na better that is there. Say you treat you for infertility, then you decide fibroid don't cause infertility and ask something else and also tackle it. Sometimes you withdraw the mawa, Emma fibroid there a shrink kakra. You withdraw, you maybe withdraw say you juma. A profund don't you juice na half if you be withdraw. But the difference is that we have refined it and look for the active components and I use in him so we know the problems that come with it. We know when to give it, we know when to stop. And we also know when it's not working. And when we give you medicine for fibroid, a majority of the time, the percent fibroid size, the more definite treatment, which unfortunately may be removal, which is operation. Sometimes the size are a war as to the sense I can't say year and ya would na ye kakodi and sakokano. Mount majority of the time so say we treat fibroid that you say obano or pese oja awodie na dachi odie de ode nyem no nyaba until operation be destroy awodie na then operation ho nim fa so per se what I say and sometimes we want to shrink the fibroid to tackle it either you be major surgery and I be laparoscopic surgery and I be hysteroscopy different types of surgery just to attack the fibroid. And now say you decide it's a fibroid really straight I think the fear of surgery means sometimes want a fibroid that normal person wedding they don't want anything to be done.
Exactly.
Now you find yourself in 2 situations. If you leave it, it keeps growing. Ebeni to the point say aye awode ni nyina ama ukoyi fibroid back one be na awode nasa then now the bell. So you have to think about that aspect as well. And sometimes allow a doctor to be investigated. No be too for now we see if we turn around. Now when in doubt, see another healthcare professional. For your friend is second opinion. Then say you second, third, fourth, fifth, sixth, forever opinion. Now you never say it die a bedroom so if they my already doctor me ban on that doctor says see I be do no. This a me ya we dey na ginsem. Nti yempese be do ho. My first statement anya fibroid nyina na yekasa ibe. Anya ni nyina na yekwakoyi. Some require say ibe. Some require say ma withdraw aboa say ibetimi. Ebi nso ho a ebe ma withdraw some symptoms you have. Na eja wo de na ma eja fibroid na ma because at the day ina person obenya oba baako. Now so dey hear how far because manyi ni ya mia chana be san ambassador kan me peba. Anamebwa nti yen ya de ebe how anabe how awode for the negative outcome nti na meka kan.
This is very a lot of information there that you're giving to us, Dr. 𝗟𝗑𝗪𝗘 khi_𝗺𝗂𝗏. Once again, if you just join in, then this is WTV Consulting Room. You know we're always here with you every Saturday, 4:30 through to 6 p.m. And then so the topic we are looking at is uterine fibroids, and now Dr. Eka normal baby say ubetie necessary na ne all can say enye fibroids ni nyina ene de sekan po eka ho ebi wo ho a wo ba hospital on different grounds ba ye nhwehwemu no so we oba ni nti yetime ho say ebi a fibroids e wo awodie ni mo for as long as or say enha wo no eno de enye issue wo so wo ha wo ho e wo ho and na all ka say bi kwa wo ho a ebetumi ama wadwo se na ebeye ketwa nea e wo se yeyi ma on nso no ebetumi aka cho se we wo se yeyi ma se ba ne se wo ho kwan se me quote da so wo ho kwan se betumi akope second opinion but se wo call third fourth fifth kai se emre na ekonenim no emre ekonenim so no na fibroids no so eye kese enti wan hwe ne yakochia na oba hospital na afie beka cho sisi ayi ntumi enyi gisi yi awode ne nyina eno eye ahomte esaye asefem eno ntimi pacho se doctor no edin komo bi efa ho a o se omo no beboa o obstetricians gynecologist no omo no betumi aboa enti menko bisa nsem ni mu enche bebre na another interesting bit has to do the fear related to fibroid surgery, it will say sekai so because sekai no no kra the thought of it Emma wakuma ebo brim kakra na what does it pa entina eya yeta issue no because I at least me who share be mo peweka so yesi me mbra na me be battle through it's not that so and no any sort of second third opinion no the first issue no what exactly do you think from your practice could be the reason in TSA ihunokra becomes a deterrent omuntumi MAE fibroids no
pain bottom line the fear of unknown ade ayi nim yesro enyina nim obi a waka operation ankoyi enyina nim emo mpempin ye refi se ye nim amanfo so mako na bibia ye fine first na nanka operation yehu ye tinsempi ye fa ho enye papa bananse operation na mencha de bibia koranim kama anse awokra amanfo the operation e wo into operation de e ka se na ye adwuma no. The second thing so I say if you are seeking care for fibroid say obeko obstetrician gynecologist ho ya doctor for be brain ma doctor for adwuma nemo obia one area or ye experts in I shall say one field in it me treat conditions ni bebre but do baby they refer to one it is their area of expertise into all corners will be operation manas and any area of expertise at na also say oh yeah odwen wo kakra because enye nim say opade ato odwen ma oni be auto no unko jidan toes for nchen enka se opesa woto indomie mbadesa ina yeduane mum obia wobia exactly into who feel say a shrub and who aba okọ obia ye nim dia you are assured say at least a juma no be ya ma no obey niye ama. And the other one, the other thing also is the issue is that sometimes a problem near the ban and shada big until we don't really see how bad the problem is. Me can say any family idea and saka. Nemum or babia so we 35 and above already no fertility is fighting against you. Also the fibroid account. That bang now be ready and sana ye fibroid no and sana wa boy home pie and sana nyinsa yaba. Oh, until the earlier we tackle some other problems, then the better for you. Until we already 22, 23 or the fibroid getting we may leave it alone. Say observe it. Observe its interest and yes, doctor so and fine 10 years, could die about 50 years later. Yeah, because doctor and any problem me by 5 years ago, no any problem and then my ba but I can say too much. And yes, I can because observe my timelines over check up. But somebody above 30, 35 with fibroid problem, no, we may be a bit more aggressive in trying to solve the problem. Not necessarily say about second, but say about how to solve the fibroid problem because of fertility demand. As I say, so baby up so into the fear of operation is that one, the negative information, and in an age hospital. Sometimes my colleagues enumerate. In your time in church room, Mount Tiasi, in young HM in Bobo Munchrow, in ye who you feel, mammy, obey us when ye, and in Temuna, a man for dons, into one come as a man, sort of conacojon bra. Nipano Koidena Quacojon, because Nyoko no Nimo Quacojon, you man says all fibroid, and so near is a swan in the Namno on Tiasi. That's other problem. Ye time into being treacherous, impatience, no. What their problems are and the best solutions for them. And then now to acquainted doctors, total doctors, and then more time. It means that 30 minutes. Now, cast them natural. Say, drug way, Miss Fire, drug way. Best school you. It will be fit total now. We have more education since our body doctor and change. I didn't know. I was also a doctor. Doctor, no 2 minutes. Then Sakama fan can hear him some amazing. No, fibroid. Yeah, drama. Total drive, bachelor pathophysiology. But you be a drone of fat and a quiet and a quanane fibroid near ye and a pea and a mamma fay and no call toilet and an ass in a come and that. Or what you need until I'll be jaddy. Yeah, Tetrum Cassata say to be a test. I say, yeah, it is say. I think that's where the problem is coming. If we have time to educate our women, remove the fear of operation and let them know so see the operation, no, you're quite fine. There are a lot we can do for them. I think say a beboa.
Me desa wa na waka se samunya emre edi mayenya ebema ehuno abafom bebre ali se bin so ho a mean say e say yes you to me open up na ye share our fears with you se ne be am betime aboye doctor yeda say na ebiom nso no na wo about the issue of hormonals me trottle ho because say last week ye family planning. Okay. Na I know you just a first bit so you besa betwa so bio na enkomodi de say ebi mo ho omunya sa irregular bleeding ya yeke and sometimes yen nuanom yin so mo ka yimu a cancer will say we your ba na we family planning na wo moja no amba chise moja no keka ne ho ano abomu na amount of fibroids. What is really the relationship between family planning and the fibroids? So, no cray say family planning between my fibroids. Okay,
back to the hormones. Say me can me say fibroid no I would no mass if muscle nim. Into any moja sem any moja fiaka our body any moja emba intina any problem. Hormones that you are exposed to over a longer period near the bar. That's the bottom line. Number 2, say obabia or when inside no inside when bun abnormal. And one of me can say so irregular bleeding na fibroid. So then she must a fibroid and to be irregular bleeding say umbun in sacra inti or not or worry. But say yen na withdraw family planning tiama withdraw not and nunti women's samba. Na yen so menses nano. In a way I am pese obetu kosua na wafa yefunu family planning sana eye adwuma ye sokosua na ye untu kosua kra na aka spec na akoma yefunu na the problem abro cause when you ready inti no say interfere in that process it may interfere with menstrual cycle and so because say yes I would no ma hoho ahoni nyinse no na so hoho na mba e be pra awode nim na hoho fofra ba sisi an so hoho ne ya si ne kwan se onyamba into bia nim se hoho bia nyamba into aprapra awode nim anya na amba na se ne wo se ba. That is the issue. Your mouth family planning pills now it interferes with the ability to have a normal menstruation because any aswano. It doesn't turn into fibroid. In 10 years, I can pay face. Family plan does not lead to fibroid. Now there are two arms. Hormones na dear family planning no. And I mean I'm say fibroid so the hormones.
Yes,
okay. Into research nature say obamnya irregular bleeding because of fibroid. And the hormones na the so hormones ni bia na use to treat
na prolong cause and contribute and na musa e de boa mi
treat irregular bleeding inti yen ni nim say eye ma ho na de ama ho. In this case why I research na ho the reason why I research by and say you can say hormones no affect fibroid into wanted to find out say into hormones and for family planning how did they affect the fibroids. The hormones used for family planning are very small doses. High doses, it should not contribute to the problem. The same hormones.
Perfect.
Ni say hormones no crowd dose more. Ni more sing family planning there no. But the good part of it is that you say ni no so I do a beer a trap na ma fibroid aba form. Into the same hormones it has two effects. It can make it grow or it can stop the growth. Into a drone am say it mean the mama and shrink fibroid and also affect the hormonal interplay. Into hormone the family planning ones don't tend to cause overgrowth of the fibroid. Okay. However, if you're on the hormones for long and you notice your fibroids are getting bigger, what they buy a better. Ni be say hormone now is an association way back and a different thing. A day jaya, a beca say jay. Say a day him say no, a beca say no. But the person who knows the name there with Macasa Semia Charles and I'm kind. Your obstetrician gynecologist on our way into ba hormone now often. So hormone with the type with the maybe it has an association. It doesn't have because it doesn't have. Based on dose now often because so with the and then in your head. Into no crano edaho. Eduani edi yan him say eduani yemo. Yan say is when you di ya. E ma onye kese how body. Inti yebedi na yendi. That's where the issue is with the same hormones for fibroid no. Because we say we did we are healthy. When did a lot of health problems. The same with the hormone fibroid. If you use it well, we need problem. If you don't use it well, you may have issues. Until we can tell you which ones are good to use, which ones are not good to use. The person can say, don't be surprised, say, what fibroid, what bleeding problem. Doctor, some hormones. But that is what is stopping the bleeding problems for you. Sometimes the hormones not treat bleeding problems.
Or say, don't be surprised, say a beer or fibroids are a bleedy na Dr. Okohuna was another hormone to treat it. And all can say the same family planning hormones na and non near do woman no yeketwano and no cry sometimes so much to me editreaty e manebo intime mane entete wo cry ye dase baby many just say why ye in church we amaye because we say enche obi ebe free ebi sabe about it e wo ho ni teacher ni say ye pa wo no doctor me pacho na ebiom no so no na enche ye woka about nyinsen ebia nipa na epe nyinsen na fibroid no so ewo ho esida na fibroid no eye akwansidie right is that akwansidie e de muscle betimi nyinsen because na oka say we say muscle issue and na nyinsen nso kusua ene sperm da no Dr. Bwedi ebetre yen wan ka muscle ho asem enti eba ne sen na fibroid yi ye muscle issue etimi ye kwansidie anase impediment to oba so betimi nyinsen.
Okay, to answer that question, yes, no. I'm checking. Say you share fibroid now, make about size, location, and what's them. Sometimes no size, no any location, no any fertility problem be any ho. Oko picture na the first na fibroid na keto na within the muscle no may not affect fertility at all. But let us look at the problems from the symptoms first. So be complaining say na ya say ne ya tembia ne menses na mba ye. How would that person say when ni kunu be hia? Amanyinse aba. Tembia moja wo ho.
Perfect.
Time no me plan sa ehiem no ansana wetumi ayeden. Na otumi yire no humpo na se moja ni twa 1-2 days bi na se o say ne ma mefa ba konkoma ne ya because na ya say ne ya. O tese bibia be hye ho nti ono onya comfortable so ni kunu be hia. Nti ba ne sa na the frequency ni regularity a ye hia say ye nra no be hia ansana nyinse aba no. It doesn't happen.
Okay.
So that's the simple first point. So fibroid no kesiye so much you say it distorts the cavity into a heart uterine cavity no into sperm movements input to the egg no is disturbed. Chemical changes na the fibroid bar inflammatory changes na the bar may hamper sperm movement, hamper egg movement, and it may also hamper implantation of the fertilized egg into those areas. So 1 year like na se unya some mucous fibroid near ewa awodi inside na fa ne say nka bebia nyi say ne kwakọ hye no na fibroid no so wo into a blood supply impaired into it interferes with implantation. Teni one mechanism so a betima ka say den fibroid ha adwen wo ho say awodi inside na fibroid na say what say grip no say more than one bebre wo inside ho na any implant baby no space issue maybe I be implanting no so since hobby brain affects the implantation then you cannot also go and implant the egg there. And then if the whole womb is full of fibroid, I guess this space ni na kesia baby no bampa into me into be or onya fibroid na no nya miscarriage e kan ho. Into those are the ways fibroid it may affect it. We should picture back on previous one na ka be mu so back no maybe so picture we fan say corner na sperm never tube inside no fibroid kese be block it sa road no sperm no be there navigating the way ako miti because na sa back to about implanting. So those are the ways there. And now here second picture now the whole womb is full of fibroid. Into bad na space problem will be holding a second.
Give me after second picture no kakwa.
Within the second if we already know na ma also suspect so 6 months pregnant. And so name poda. Because I would na full of fibroid. Into one picture won't me be I would start baby ako. Where image ayatwa or abdomen inside the camera through what we call a laparoscope. Inside the abdomen and yako sign for knee abroad into I would from inside the body where life will be life picture abetram. Into say I wouldn't know full of fibroid that baby no enya baby enda. So these are the ways fibroid eya consider emma nyinsen and fertility.
Into we the ebia na asefem kakra say ya yehwe no say ye hu bibi kese say but senior doctor eka say we obi life ade a yetumi etwa ye de ekire na me pese maybe sir trust bibi kese say no kra no ansha say prekope
patch debi. It takes a while for growth. It takes time for it to grow to that level. Into over check up, we may see it. And when we say, oh, for now, and your problem, you monitor, you observe, yeah, we expect that every 6 months to 1 year, you come back for us to check again, see, okay, Annette is saying, how is it going? Symptoms, no symptoms, problem, no problem. Yen to us, and I answer management plan. I had to be catching me patient say, and now banana casam chem nam so where the nursery. Now corners are still at a she. Rebecca Chem said, Doctor, I said, I'm not casting a she, no. She in temperature, she mammy. Message when you massage, I didn't cast, oh, still at a she. Now was I the who calls and no, I didn't air she, or bands, doctor. I didn't air you. To see idea. I'll move it to the next step because first I may take that, normal. It is not a problem. Okay, second time, third time, I now escalate my worry about the problem out there, and then I add more weight to it. And so, you can say, oh, and yes, she are okay. That's what we say, yes, and as I say, but still worries you. You come back and tell us. That's why we are there. It beats you. If we have to reassure you, reassure you. But when we reassure you, we don't say, oh, forget about it for life. Reassure you. Remember, review. Say, corner Brian says, and I corner Brian 1 year. Just make sure you honor that appointment and come back. And I say, bad dinner. say na me yemi die me birthday bebe me na ko check up enti me say every year bia me ko ne tete kurumu bia no me ka the doctor last me buy we na me de buy mo say nya hwe this year ma ba mo hwe sister la nya hwe ya me kra me doctor kra nya hwe from me ye bi me kwa me say mo hwe no masale amro enti sa na ye no then at least with time no what we have to do for you betimi ayama
enti so order for ebia na ebiomo wo chance obebisa question na memma no how ye be telephone lines no in no time but monim say yeah telephone lines no 025-625-3461 025-625-3461 and that's a 053-8350-625 053 and other for you say and course no ever be brave Dr. ADH where there you be answer questions over answer questions be brave am my year now message you be call the break briefly your bar na yasan atwa in common. So this is the discussion with Dr. 𝗟𝗑𝗩𝗪𝗑, senior resident at the Reproductive Health Center 𝗪𝗪𝗩𝗘 Teaching Hospital na ene ye share you trying fibroids or questions no ene or WhatsApps be to me aba na e be telephone lines and no so be to me e bisa wonsem no. You can also drop your information on X. We'll just pick them and address them as well. Yeda Masibebre say you are in tune with us. Koswara and the WTV consulting room. Na sheyeng. Thank you.
Meye mi fie Christian fie Mema mi kun aye Christiani na me mofra aye Christian fo Mema mi fie aye Christian fie Ban papam eye dwumadi a ekoso ewo WTV so kasa afa ekwaya ye tete ye mofra ekwan a yebefa so ama yaware ayefe ne yaware adimu efie entete anase efie siesie ene efie nkomodie mu nso yenya entwenten into me to safro se hwe WTV na niema pa bebre ewo WTV so enwumpa enkomodie papa eniema pa ebeboa me no mienu ene yemfie koso ara na hwe WTV.
And here, that Masibebre say you patiently waited for us. Then him say course na there and doctor will be back as with theater because so say my sha say because say your issues be brain ti enya say ya na ye ni ajibebre. But don't forget say your WhatsApp lines and so very active. Enti wo friend na say competition our line so very high. With them don't worry. Send your message. I'll read them out to Dr. 𝗟𝗑𝗩𝗪𝗪 and he would do the needful to them for you. And yet also say your lines no ye be opese obisa question opese share experiences obe to me yes hello.
Hello.
Yes my dear mpacha what to say Nyamia Domboko yeah that's the say and then so wait to me afraid in WTV yet you
Maybe say 19 weeks, but I mean, say your fibroid. And me call, I'm going to go check scan. Me go check scan. I'm going to say your fibroid. And I'm going to okay. Thanks, doctor. Say, but then I'm making I have some.
Okay, it's mpacho me the ejewa account. Oba ejewa. Hello, Mami Ejewa.
Yes, my dear.
Oba Ejewa.
Ma,
Mpacho ye tie wo betimi ama wo neso kakra ache.
let's say, my China no problem kakra. Me see me university with 2 months.
Okay.
It's not no one me think kakra at the beginning na me year. And I go Ghana college so only for me. You have next 3 days in na. Mama me koye scan results me buy. No mo say fibroid. Then this is when you have fibroid na it now make you feel than
It's been my day.
make you feel.
Okay. Yeah, that's it. Right. This is to be sasa unya fibroid so to my messy period. And where the you fit touch my naba madina. Manlizi. Hello, Manlizi.
Oh, ma.
Yeah, that's a sawa free bring patcho ye tio. Madina for what to say.
But,
Yeah, that's it. Patcho bisa wasem now.
but, na, is a real. And can but,
Oh.
but, they will find I swear the time for I say how much I wumbu dan taban ni na wo hono almost ba ko so abegina mo se nti se nanyin biom kai ntin en ahode se ya aba ma akola na ya kama na ntin ye ba ne ba tie na nchama me ma wo aka no mo ya de ye en so ti se ani ya akosi se dia Manyana was an idea, you put out in an asset. Nanko chat and shed the acquisition that.
Okay. And so what would you say in so agena I would dear ne ataba anymore. Okay, yeah, that's it. Oba Cecilia.
But good evening, ma'am.
Good evening, my dear Pacho, Northern region for what to say.
But you.
Yeah, that's
but my problem is say, Mimi de me said the Shamaya here.
Pacho, yeah, we are listening.
But I said, you me said the Shamaya said, and in fact, I didn't be on my left hand side, my you, me 2 months. It doesn't mean because any 2 years fibroid bag the Anna.
Me that say. Doctor Kankubisa Cecilia say, "Hey, what do you show here?" Cecilia, Doctor be answer what say, and then Felicia, you feel nothing rigid about Auntie Cynthia.
Hello.
Mama Pacho, good evening. Come on, for what to say.
That you be
Yeah, that was it. You.
If I told my own, yeah, I'm serious.
Okay.
And when you have talk, you bring it down. Doctor, can't you? It's only because me really a many.
Ma'am Pacho, just a quick follow up on that. Who you know, every day na bleeding start here.
Then 4 months, you're not a
Okay, in a 4 months, Chimoja Nesha see you too.
I did this now 1 month.
At twice 1 month. Me Pacho. Doctor ebe to me ebe my answer na ye fa question we na fe doctor answer the questions no Mami Adwoa. Hello,
good evening.
Good evening, my dear. Mpacho is legal for what to say.
Yes, actually,
Great, so please we are listening to you.
Me Pacho, me prefer me bisa doctor say na me call hospital mama me exam tinya di almost fibroid me kete endru we kra. So now me bisa doctor say, is there anything that makes me a may de prevent ya grow ana?
Okay, yeah, that's it. Nti Doctor Bema o emoye. Doctor Pacho, you be to me. Okay. Yeah. Okay, we fa Eva and Kaho then. Hello, Mami Eva.
Madam,
Oba Mpacho, what to say?
Bachelor, they are the more now.
Nyamia dombo Mpacho yetio.
Never show me the family passage. Number connection says, so we are planning. None menstruation and for 5 years. Let me try no, and I'm not trying. And then for 5 after.
Okay, yeah, that's it. Yeah, that's it. Right. Comfort is so about dear. Hello, Mommy Connie.
Papa.
Mama Pacho, yet you.
I'm Pacho. Bible war. Na Madame Quat. No Pulueno. Naya didn't bedu. Nanka maybe Saturday during our walk and Wobotum, one and the dinner. It's an ayaka crabba mask. I will be Joanna.
Mom Pachosia aids in fear here. In that we are Ubanus ways are here.
I'm Pacho, mother 5 years.
No one can sense where.
And Pacho, much more 39 years.
39. Okay, Pocho, Doctor Obama, no ye. I ain't na yet Linda Cohona Afi. And then, you're sure. Hello, Auntie Linda.
Good evening.
Good evening, my dear.
Mepacho, Antana Mewono. Me were bar, me want my woman and paying at 12 years.
Okay.
Antana meaning that will be another doctor said fibroid will you. You fibroid in the plant and you mean thing.
Right.
I will home and media woman. Aha, the better good doctor temperature. And having so, you do hide this near your found.
Me patcho, yeah, that's a baby. And Dr. Ma Obia no ye na fe will take the other set of questions. Right,
okay.
Doctor.
Tisana American, the first one, Nipa no nyem no anti patcho sorry some refuting. Name say one nyem nasa wa fibroid ubeti or Dr. Bekachro because it is very important say about who buying in fibroid in major issue. A bit me a warning process no it is important to obey or doctor no instructions no so as to yeah your fiber that you say baby fan no about nutrition so be the balanced diet, more fruits, more vegetables. It's very important. Say you no sa e bejai say you no cigarette and so and no see bejai those habits make fibroids worse into alcohol, cigarette smoking. A good diet and exercise is very important to maintain a healthy body. Once you have a healthy body, you are okay. Me that's a pan say call us a fresh say oh na more fibroid means how me ba na more fibroid means how me ba. It's very true. Say that kind majority of women have fibroid. They won't hear say a baby be a fan. Until we leave it alone, your children will come. You don't have a problem. When the fibroid has given you a problem, or tackle it into you na your fibroid that a problem be a damase. Somebody sad and say na mami. Mo twaso sa na mo hwe mo so ye na mo nyanya ese mo ye it should be fine. Okoko ye den. Ne dey sa share say ko hu ade no. Me pacho now gynecologist and passes speculum in mouth. Most of the time ye dey sa share say no. Yen cervix wo ho. E feel firm. Into one year like in adults, I shall be feel say be it may be normal cervix.
That is like I would do.
Normal, I would know. Your friend I would know cervix. Right. Some of us feel it and think it's a problem. Until just go for us to take a look at it. When we pass a speculum, if it's that, Ebakacho says that. If there is something else, it be cultural. Some fibroids can come out through the cervix and feel like a mass, what we call an aborting fibroid, a pedunculated fibroid. It's me by my feeling. Sometimes I know see being near your shama. Can fibroid cause your menses to be irregular? Yes. Any woman can have no menses at their point in time and can also have fibroid. The two can coexist.
Amazing.
In debate men who say, oh, menses by number or fibroid, the two may look the same. And then they say fibroid near menses nature.
Okay.
But you may have other issues that is making the menses not come. Until we rather will look at why your menses is not coming. Rather than say fibroid in a menses number, it rather may cause irregularity in it, but to stop it altogether in your common presentation. To make us say menses number as a fibroid that go and find out why the menses is not coming. So that I should also see be how then you are reassured, say everything is fine, and then you can leave it alone. I think I have answered all the questions.
And now back on so about or your family planning. I will say it be more period irregularities no any problem.
Family planning can cause period irregularity. Family planning can also cause dizziness. Into say what any dizziness are, then you have to go back for them to look at it and find out that family planning causes dizziness and that's another condition that causes dizziness. No, one more family, one more need to know say family planning causes dizziness. One more may amount. I be better. Say another thing so then they will look at it for you. Obu ho mo just what onya dizziness. Obu ho afa edrono chair into edrono ewo system ni mu new no tema ni feel dizzy kakra edrono ba system na say ni system ne fa ebejai but too much okwa omo nim de know what to do behwa ma na ne wo so on the mount no the amount no me treat amount
me da say emra doctor eguso answer questions na nyina say bia wo frɛ na wonsa anka obetumi send a message via WhatsApp line so and also ye be kind na Dr. Amawo eho emoaye and I say your Facebook page no even the X and also ye betumi ahwe noma watcho ho no na Amawo emoaye me pacho doctor
I think say me refi madam na o can say need no wawo ba combat one baby I think say me refi madam the question no say which so what fibroid that's when you saying that now I would that then you know that fibroid is not the reason why I want to ember because I didn't know that what they are and you have never cause a problem and the good thing is say you saying bar it's me seize fibroid growth no into the old fibroid don't tend to grow bigger after a pregnancy and a delivery.
Okay.
So a early miscarriage it may not affect it but by the time you go to second trimester, third trimester, pregnancy and delivery now, it tends to stop the fibroid. Into that will be to me one in the into that fibroid will not grow anymore, will not give you problem. Into say previous fibroids are warm, but I think you should go back to your gynecologist, preferably a fertility expert. Now on finding out what is the current reason in here. I want ember, but it may not be the fibroid. Unless it's a new fibroid that abba, but the old ones don't tend to persist and give you problems. Once you have gotten pregnant, I won't know. It tends to seize it and it tends to even make regress, make the fibroid even shrink.
Amazing.
Further, yes.
Right. That's great. Now, doctor, sometimes other questions. Sometimes it be ye fibroids now. Does it regrow again? Because at least I've had a friend, and as a friend's beer, why patch up me, but Mammy Fa or Bad Jemima member. Hello, Mammy Jemima. Patch up, Castle for want to say. Yeah, that's so afraid. It's you. It's you.
We are family in 2002. Now, I have a son, you know. A going yes, I will be a woman about one. I'm a living thing. Yeah, but I wouldn't be my say one of my aunties. Because the doctor and the boy and living for a oh, boy, and I really bring this. I'm just saying, because
that's it. That's it, right. Okay. Dr. Bema home why now with the yes Kaswa is it Auntie Dorcas? Oh, okay, Douglas. Hello. Yeah, that's a set wafre amaye. Pacho yitio.
Pacho nana Pacho question being a person bisa doctor nona like mwaka kana mepe funeral.
No problem. We'll tell you her.
Da we no can operation as bisa na. Sa we ne bo en map minimum.
Okay.
Yeah. And I'm just like, if you are person, we have operation and we treat here. One day now, the first one, process you are making a first making a man, process be a making a first condition. Because my wife was our we need to number percent. Yeah, no too.
Douglas, Pacho, over to me, Esisubium Yantini, you say condition bay.
Condition, yes, sa we na ya bo ma minimum.
Minimum.
I said like I just Ghana your friend Ponko said.
Okay.
Yeah,
okay.
Yes,
right.
Process ben ya be faso no be tiama me adie kakra na.
Me patcho you doctor said goiter then the wakopi goiter that say daughter ma ho emwaye and oba rich love Paulina. Hello Mama Polly.
Hello, good evening.
Good evening, Madam Ku Efwa.
Madam Ku Efwa, how far?
What's that, sir? Thank you so much for calling, my dear. Please, we are listening.
Some years ago.
Okay. Right.
9 years in here. Dr. Anika, so it wasn't any problem.
Okay.
She said me menopause for 5 years now.
Okay.
The person say, is it dangerous?
Right.
So me man call you who's BBR, me to my relaxing.
Me patch you, Mama. Thank you so much for calling, Mama Paulina. Right. Me patch. Hello. Hello. Okay, Dr. Pacho, to me answer these few ones. No, na wo answer now the account. Na me bisa about surgery issues. No, if it's real care.
The fibroid regrowth the enya dia ewo ho. If you are surgery ye fibroid na ewo ho no, into that one will not regrow. But tell me can muscle mass into new growth can occur. To beat my surgery ne. Ye problems ni na this maybe kitty be a those one will keep growing and the new ones may grow because near the problem by first time no say na kind of cause tan kasa dey sheda hu inti by na yan solve cause problem no nemu ye remove fiber na this size ba no inti we are inti na ya advise those who of us who want to have children after fiber surgery we advise you if you want to have children now is the time. Move forward.
Yes.
Into regrowth, the main case.
Okay. Listen, Pacho, me for Eunice and Council from Nongoa. Hello, my you.
Yes.
Pacho, so who ye?
Pacho, good evening.
Good evening, my dear Pacho, you too.
And Pacho, the thing is, okay. And so, we in Shamudia, not in Shamu saying.
Okay.
And hence, it was many fibroid and so, the thing is that again, a process that.
Me patch you.
Because first time, almost a shame near me.
Okay.
But many financial, we are
right. Thank you very much, Eunice. Yes, sir, I call Kaswa from Nongwa. Mama Rita. Good evening, my dear. Pacho said Mohoye. Nyamia Domboko, yet that was a sour friend.
I am a kind of except Masepa, and my own. But I didn't know that I said no book. I want to be better doctor confirm it, say true and not saying true.
That's a confirmation.
Doctor confirm me say any good. Minim true or false accept. My doctor confirm me say any good. Yen ho ya say inside ho and non kasa ho no ho.
Pacho say with the straightforward. I say any true or false. Any good into ya bia oh ya dear okay dear me Pacho
what's it was na say na me kind how does fibroid cause infertility. In my example, is the first and foremost symptoms be walk around and ma in shame number. Na ye lady ni complain say na ya see any ya to the point say FACC no creating cannot come because I dear ya na first when him there how unponye. That is the issue. Mess row say we be call hospital. Na we be say our doctor and say conditions be brain no bono. Na hypote I how there no bet me solve your amount. You start one step at a time.
Okay.
You find back. Sometimes no two or multiple conditions. You change back. You both diagnosis no don't cry, baby treatment back. Inti okwa maybe a simple treatment obet my yama. say a hona ne koye din a say na me can always go for a second opinion between a doctor for ho na wa check on problem na wa show problems be brain na which is the one na or solve ya or symptom be better na other issues na can ho na eden itimi ayama there's a lot we can do for you atinka wo ho atinka ni ho pain wo ho pain ni ho it's a lot we can do for you nti no wo ho
okay Dr. Back mama fa
Douglas asem no over call
nkame fa Stephen of 𝗪𝗪𝗑𝗪 na me dey aka ho and then Dr. Kweno mpacho also betimi asend no message hello Uncle Stephen.
Yes, mommy.
Mpacho yeda sese wa free yetio
yo me me da sese my boy me so me wo problem my wife me ni fa ifu mama akra no enya be 6 months na e wo di yim but after I don't know ni say name ba we could just scan no say our fibroid.
Okay.
Ti ya yebia me hu some we program nam me friend me bisa kwai ba fa so ani say meet me aba bi on my say ya na ya ma chere ne no
me pacho ya da sese wa free nti yakopie wo western region innocent. Hello uncle. Good evening eja pacho se mo ho ye. Yeah, there are some patch you.
I fibroid no if only operation unit solution and a control this or a man a young almost into control to be an activity fibroid.
Okay. Patrick does it. Mr. Innocent bisa say, I think we said it already, but it be a sad time not joining. Or bisa say is fibroids need solution and ne operation, and I say there are other means of intervention. And no question. No. Yes, hello. Hello, Aunt Sarah. Mama Sarah. Hello, Mama. Good evening.
Good evening. Sarah.
Me pacho ya da sese wa fe yetio.
Pacho fibroid issue ni wobi.
Okay.
Na me go try scan na mo say question you no. Ki anasia ni scan ni kwa manasi ya media ni bisa. Ki me yan amko ya mo te ni asia anemia ni gan akupo. Okay. Ki se no doctor. Ki omo tina kwanya me hospital.
Me patch you. Yeah, that's a set wa free doctor. Hello, Uncle Solo. Hello. Hello. Me patch ube to me ama wo TV ni volume na ko for mama ye. Me da say mpacho yetio. Lower TV ni kra
Doctor is charging.
Thank you. Right. Mpacho, you can answer these questions while we wait for the others.
Mr. Douglas question I'm very fee.
Yeah.
Thyroid any operation depending on the one you have and what is happening. Sometimes I may draw, sometimes you may gland, no. But it's a doctor by operation, a better operation crop by what you have to go through before you can get to the operation. I wouldn't want to, because me name or size, me name or current state, me name so being here medical intervention before the surgery. It means me and interfere in the treatment plan. I would say have time to talk to your doctor and understand the process or better what you should do. And local hospital which is ask your questions. Now Joe answers and waba. That's the first one. Not all fibroids are operated. Even the ones which are symptomatic because there are problems in an operation. There are some medications able to control the symptoms, and some of them are operated based on the symptom they are giving us and what is the end result. The size is so big, it causes compressive symptoms, it causes other obstructive symptoms. Then we want to reduce the size and want to do operation to reduce it into a operation and reduce it womb size, and the problems it comes with.
Right.
If we think it is blocking fertility, and we know how it is blocking fertility, and we think if we remove it, it will allow the fertility to come, then we are doing operation for that reason. But senior kind is so common that with the you chase fibroid for everybody and operate everybody, and that is not the end result.
It shouldn't be.
Okay. Senior kind and your fibroid ni nara and a cause fertility issue. A man for they have their fibroid, they have been able to deliver. Into the fact that fibroid interest, that is the cause of your fertility problem. You must still go and see your doctor and have the discussion and find out what is your cause of fertility problem. And then if they think it is the fibroid, you better catch out how to solve that problem for you. In pain, you blame man. Of course, with the doctor saw fibroid, and then the problem near until we fibroid now, my man, the uncle be crying because on himself, ban or fibroid. But 3 to 4 out of 10 are fibroid. Into nipa 10, na se nipa 4 will be, and everybody has fibroid. Into kind of say, why be opinion say be our fibroid? Into the blame fibroid independence 1 year fair. Into have the time to discuss the cause of your infertility. And if we think fibroid is contributing to your infertility, we will tackle it for you. But I like the fact that a nipa 2 in a day in saying a back and son I want a back. Into ya mama small one name hospital. As a doctor, no, I confused. Doctor name style or bebwa because I want to me find a home kahu. Into yes, and another doctor, I had the amano. Ye pe bema ne bisana sama yenya no. Ye pe sika ye dia yenya. Ye pe futu ama couple na yenya one side. Into your bad babe can with you no. I said now this was a one tear see ye so the wrong instruction be fee pe.
No more.
Yeah, they are some about. It is better say the two of you come. We have a discussion between the two of you. My instruction for the two, you know how to tackle it. And that's what I would say. And your fibroid need cause infertility.
And your fibroid need cause infertility. And then you answer now what say yes surgery also. Dr. Mpacho obi asimbisa and said that's queen that say wo bisa and say from a shaman or say doctor ye per se you who say aso fibroid no ni be to me. I'll say, let me read it in English. I want doctors to explain to us if one can take seed with any of the type of the fibroids mentioned. And then the second one would be which one needs immediate attention when diagnosed, please.
Okay, so any of the fibroids you can take seed.
All right.
Any of the fibroids can cause infertility. Not that it's a cause, but it's an association, it is there. Now, the commonest problematic ones we think are the submucous, because I think we are saying that they are in the same space you are going to implant, in the same space the baby is growing. So we think that is the cause of the infertility problem, or that is the one most associated with infertility, so we say. However, the fibroid that needs the most attention is the symptomatic fibroid, the one that's giving me the biggest problem. In Jobi or fibroid, that's because of the fibroid, when you have heavy bleeding, we need to solve the heavy bleeding problem. The candidate so bleed or anemia. To the point of anemia there, we should find out if that fibroid is the one causing the anemia, that fibroid needs to be tackled. Okay. It may be as small as a 20 peso coin, but if we don't remove it, that heavy bleeding will not stop. Oh. In that case, no, fibroid needs to but you could be so saying what they are saying in Yashi. That's why I cancer fibroid is based on the location and the size and the symptom at the back. As long as it's giving you symptom that requires medical intervention, we will give the medical intervention. Okay. And in that case, no, abdominal surgery, we have laparoscopic surgery, we have hysteroscopic surgery. Until by which of them applies to you?
No, I share. In cause infertility, and I say, see a war who quite na emomoka say it depends on baby fibroids, no a baby see any insurance signs are wunya, any affair ne kessie, and no so bit me a factor. Dr. Mpacho na obi ibisa earlier say, sebi on any who can for Asia na insu no asayaba aso. Any relationship to or with fibroids? The
relationship per se with fibroids means I say definite.
Right.
In pain, no, me brain are complaining so many omukulumishia insurance samba, and it becomes a significant complaint. Say a peba, and in himself, remember no sure na inside that. You better nyabano. Until we do the association a lot. But if you ask women, and women are being honest, majority of the time only be me share. It will be almost sorry and she'll be saneba. And then you know ye semen no. And then you have sperm, no, make say semen contain the fluid and a sperm, no. Uno share sperm, no, will swim up. The fluid may not go with it until sometimes sorry, as a neighbor. so why would that na say I want what problems and as a pelvic floor no problems are sometimes you only ba but majority of the women omni kunu share bibi sane ba inte no interest in abnormality when we think it's a problem we would advise you what to do to improve your chances of fertility with that issue, but we will not blame that as a cause of your fertility. After all, wow, too. Something new has come up that is causing a fertility problem and not necessarily the fact that I will reassure women, if you have that problem, unu russia campaign kakra da wakakra na sperm ninya kwan swimming cup baby I was after 30 minutes be sorry na wo mo be ejuma no wo mo ko baby on ko
ba ko pene be ko
de no wo mo be ejuma mo ko baby on kai no e nsuo na nourishes sperms no na be pia ba. Yes please.
Right, me that's it. And our Facebook obi so ebisa say fibroid no na size be na e be warranty say e was your operation, even though I think you would want a further explanation on an earlier said.
And no the oba examination the sabeka we fu no hair fab awode size no na share in terms of any relation with your body no your size that you hu e be kase we the eye kese anytime I feel say fibroid no enyi dru baby wo navel no one no pacho unfruma no I kese sin unfruma no any day we will tell you say no size problems best at yaba. You need to have it operated. If it's below Fruman, then we are looking at symptoms. What the aba, any age near say okay, based on age, based on symptoms, how the aba, based on the fact that size no and do from animal symptoms no warranty say be operated, be catch. If not, we'll tell you which of them needs to follow up, which of them we can do other things into in our. So if you are doing laparoscopic surgery for some particular kind of fibroid, no matter the size, we may tell you let's shrink it first, let's do this. The size alone is not enough. The age alone is not enough. The symptom alone is not enough. You can't say for you need this, for you need that. Until I'm kind of biara and never catch so being and I know so media need to say me uncle dear, Akosia call and need any biana miss no one tea, Akosia your operation mana and mean your operation. Yes, and it's here. Yes, Akosia problem kakra is no problem kakra. Akosia will 3 uniba. Akosia the 30 or 36 into differences womb into yes and yes.
Okay, into yeah that's it. Into Dr. Eka say Nina eba together and sana or mom make a decision on your case. Say it was say we operation and I say it was say ye be before a mouth. Reno Eko bebre yenim se bebre ewo line so nyanka mobe free and I said your lines could come true any more messages. We started by saying but the Yahonoma endorse. Dr. Etelabi, why you did bebre for the time that you have shared this deep insight with us. And I know say Ubikwe Bisas, Dr. Hifana or on person beba honomo in CVHS, Dr. or Kolibu Teaching Hospital, Dr. Sisi Kalibua, Enye Husa, the Mariferana, Bomodiana Bra, Gaini or Mobesho, na what was said the Bobia needs me a day abo. Me pese Mijina, Aquini so with the WTV crew, and I just say a big thank you for your time, for the knowledge you have shared with our viewers. Now, you say we made a lot of impact in their lives. They would know what to do. Now, once again, this is Rose Aduful, WTV Consulting Room. We always come to you with the best of information, best of very educative programs and activities. Tinye can send me adoma and then now memle that's say no 9 ekopem no 9 if akopem nunsia yebesa ishim wo hasebio. Thank you so much Rachel last week for sitting in, and then Mr. Ashon, our production manager. You can't be ill, you know, right? Into obiasi speedy recovery. Now you feel that and thank you so much Mr. Prince and then Felix and then all the other crew. We are so grateful. Thank you for always helping to Gideon. I could not have forgotten you. Thank you for all the support you put through to make WTV Consulting Room a very successful one. Nyami Unshramo na nyami yadoma and next week say yebesa eshiemu ewo ehasebio ebio munso no mema yenia bema osofo Reverend Dr. Emmanuel Mensah Yako ene Osofo Jonathan Gordon uma me ene wo papa nso a safe burial, right? That is it. So what between mom krabia nyami ehia mo bebre na onkoswara omamo akoma ene bimbo. Thank you. God bless you. See you next week.